Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then metastatic deposition, hypocalcemia and acute renal failure. So in acute renal failure, hypocalcemia can occur. Number one, it can be due to the metastatic deposition of calcium phosphate may occur in various sites, thus resulting in hypocalcemia in our blood. Or it can be due to the in acute renal failure there occurs derangements of vitamin D and parathyroid axis is common. So this can also result in hypocalcemia in the patient.
thank you and thank you for watching.